Jim Hyde. What's the most important measurement to know if you're pre-diabetic? The number of hours that you spend over 140, your blood glucose. Now that's a simple number to get. All you have to do is get, it used to be incredibly expensive to get continuous glucose monitoring. $700 to $1,000, and you still have that. It's improved. The price is a little bit better than it used to because it's getting major competition from a new device called the Freestyle Libre, Libre. And if you have questions about the Freestyle Libre, just look it up, or Dexcom 6, Dexcom 6. We've got plenty of videos on both of those. And they both just attach to your body. The Libre attaches to usually the back of the arm. I've got many videos where I've shown that. It's a plastic button, white plastic button about that size. You pop it onto your arm. You literally do not feel it. Believe it, it's amazing. Those of you that are worried about a needle stick, you don't feel a needle stick. It's got a tiny little 1/2-inch filament that goes into under your skin. And for the next 14 days, you find out exactly what your blood sugar is doing. Now, there's one other thing that you need to be aware of, though, Jim, and it's helpful to know what your insulin level is. So, unfortunately, there's not any significant viable insulin monitoring device. So what we do is we do things called insulin survey. And that is basically taking, it's like an OGTT, oral glucose tolerance test, but you add insulin values as well. So you fast for at least 8 hours. You take a fasting glucose and a basal insulin. Fasting glucose should be in the 80s. It should be below 90. A lot of people don't have that low a number. Then you give 75 to 100 grams of glucose. It's usually that sickening sweet cola. You should not get over 120 at 1 hour, and then you should be back below 100 after that at the 2-hour mark. In that same test, if you'll look at insulin, the insulin should be basal insulin at 5 or less. It should not peak above 50, and it should be back down to about 20 or less at 2 hours. Those pieces of information give you great information. Now, what do we usually use instead? Well, your doc will usually do Hemoglobin A1c or fasting glucose. I have plenty of people with fasting glucose well below 100, and their doctor tells them they're fine and they're full-blown diabetic. In addition, I saw a patient just yesterday with a hemoglobin A1c of 5.2, which is a great low number, and the doc would say, yeah, you're fine. And they were full-blown diabetic. In other words, they peaked well above 200. So again, we get, we're not doing what we should be doing in terms of watching this disease. And this disease, prediabetes, leads to heart attacks, the #1 cause of death; strokes, the #1 cause of permanent disability; #1 cause of blindness; #1 cause of kidney disease, etc. Continue to get great feedback regarding the webinars, and here's why. You know, on the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.